Good afternoon. My name is Dr. Aziza Babajide. I'm a psychiatrist here at Cambridge Health Alliance, and I'm really excited to be speaking today with Dr. Margaret Weiss. So, Dr. Weiss, I want to ask, what will you be discussing at the conference, and why is this important for clinicians today?
I'm very excited to have this opportunity. As you mentioned, I have a long passion for all things neurodevelopmental. So that would include ADHD, intellectual disability, autism, learning disabilities, language problems. There's a wide range of neurodevelopmental concerns. What I hope to do is give the clinicians in the audience a sense of each of those disorders, and most important of all, how they, as general clinicians, can feel confident in recognizing those disorders and taking first steps to getting that patient the appropriate services.
What's the biggest issue or problem related to this topic that you see for kids that you work with?
The most serious issue is that for some of those disorders, there is a healthcare disparity in access to assessment and treatment. In other words, in our outpatient department, if someone presents with conditions that we're all familiar with, such as anxiety or depression, then the pathway to assessment is pretty clear. But if someone presents with difficulties that they're not developing language, or that they don't have social relationships, or that they're behaving in very odd or bizarre ways, suggesting a potential autistic disorder, then the pathway to assessment alone is 3 years. And the pathway from assessment to treatment is an additional 2 years. That's a very serious situation because you're talking about developmental disorders. And for developmental disorders, early intervention makes all the difference in the world.
What are you hoping that participants are going to leave the session with?
To be able to give each participant a magic bullet where they make a difference in that 5 year wait. So there is, I think, a misperception that some of these difficulties are very mysterious, hard to assess, complex to diagnose. And in fact, for all of these conditions, screening is the order of the game and easy to do, something that any clinician can provide. For all of these conditions, the first order of business is to recognize it, name it, and give the parent access, whether it be on the web or otherwise, support association, to be able to understand what makes their child different so that they can help rather than blaming the child for the disorder. So at the end of my talk, I think we'll be able to move the needle a little forward where each of you in the room will be able to say, I think I know what's wrong, and take first steps to remediating that 5 year wait to something much briefer.
That's wonderful. Thank you so much, Dr. Weiss, for speaking with us. And we're looking so forward to your presentation. Thank you.
Thank you for the invitation.